used to being busy. However, this is a new busy for us. Because what is notable about this moment in time, however, is the amount of preventable hospitalizations that require, quite frankly, an inordinate amount of resources. Speaking as an obstetrician, I continue to see pregnant patients with COVID who are unvaccinated. And I understand, we all understand the concerns and the fears that pregnant women and their families may have. And I implore you, reach out to your obstetrician, whomever your obstetrician is, whatever system you're receiving care. They can help alleviate your fears, and they can share with you the science behind the vaccine. Since July, we at Carilion have admitted 830 patients due to COVID-19. More than 80% of those patients have not received one vaccination. It's our job to take care of all of those who are sick, no matter the reason, and we will continue to do so. Still, it truly does break our heart to see patients who are suffering when they don't need to be suffering. And unfortunately, those preventable hospitalizations may delay care for other non-COVID patients that may need our help. All of us in our regional health systems are here today to face that challenge, and we're all facing that same challenge. Over the past month, hospitals throughout our region have seen a significant volume of patients. It doesn't matter which emergency department it is. All of our frontline providers are tired and are struggling to keep up with the demand, a demand that we take to heart, a demand that we all signed up for, and we will be there and we will do it. But our folks are tired. Today, I'm joined by Meg Scheffel, our Chief Nursing Officer at Carilion, and a nurse herself. She represents Carillion's more than 2,500 nurses across our system, and she and our nurses similarly know firsthand the challenges that they are experiencing and they are facing across our footprint as we tackle the challenge of the resurge of COVID-19 patients. As I mentioned, indeed, many of these hospitalizations are preventable. So please, if you haven't already been vaccinated, become vaccinated. Vaccinations are a way to train your body to fight COVID when you're exposed. You know, recently we hosted the Ironman event here, and all those folks who participated in the Ironman event underwent years and months of training. So think about the vaccination as a way to train your body to prepare for this challenge, or the challenge of the COVID-19 Ironman, if you would. We need to tackle this, and we can tackle this disease and the surge by having folks vaccinated. The best way truly to support your frontline workers, the best way to support your frontline responders, the best way to support each other is to get vaccinated. So please, I implore you, if you're not vaccinated, become vaccinated. And I know that my colleague, Dr. Carnell Cooper from Lewis Gale, will agree with me. And at this point, I'd like to pass that baton to Dr. Cooper.
Good morning, and thank you, Dr. Weiss. I'd like to emphasize one of Weiss's last points, and that is the impact of this surge on healthcare providers and first responders. Throughout this pandemic, the healthcare providers and first responders have worked in partnership to provide the absolute best care possible in what has been a very challenging situation. We have responded to changes that have occurred sometimes monthly, sometimes weekly, sometimes by the hour. And through it out, we have provided the absolute best care possible. Never has the partnership between healthcare workers and our first responders been more important as we've worked to take care of our patients as well as ourselves. But we are all growing weary. I am a trauma surgeon, and I have worked with our staff to watch the challenges that occur when a provider has to give an iPhone to a patient and have them say goodbye to their family. It is challenging to hear as a patient takes their last breaths, their regrets about not taking the vaccine. It is our calling and our privilege to care for patients during these very challenging times. But it's also our duty and our responsibility to emphasize the tools that are available to take care of our community. And the most important tool that we have in this pandemic is the vaccine. I've been vaccinated, many of my peers have been vaccinated, and millions of our citizens across Virginia have also been vaccinated. We are asking for you to help support our individuals who are fighting this pandemic by getting your vaccine. The other thing I'd like to emphasize is the importance of seeking the right level of care. Again, as you have noted across the country, examples of areas where they've started to have to ration care because of the collaboration between, again, our healthcare workers and our first responders. We have not had that situation here in Southwest Virginia. But in order to make sure that we continue to be able to get the best care possible, we have to be cognizant and emphasize using the appropriate level of care. If you have a non-life-threatening injury or illness, it's important that you seek care in an urgent care area or with your primary care physician. Certainly you should call 911 or the emergency services if you have a life-threatening injury, but it's important that we continue to, again, use the appropriate level of care so that we do not get in situations where our community does not have the availability of the care they need. We will get through this. We will be stronger and learn and be more knowledgeable at the end of it. We ask your support in getting your vaccine and in masking and doing all the other things to protect yourselves as we walk through this. Thank you very much. I'd like to turn the mic over to Chief Perlman.
Thank you, Dr. Cooper. In an effort to match patient transport needs with available resources for non-emergency medical complaints, you are encouraged to seek medical treatment at your primary care physician, telemedicine, or at one of the local urgent cares. As always, please call 911 or go to the nearest emergency department for critical conditions, life-threatening illnesses, and injuries. While an EMS agency will never refuse service, non-life-threatening 911 calls tie up valuable medical resources for patients who could be experiencing a true emergency. There is a misconception that by calling 911, you will be seen sooner at the hospital, and that simply is not true. When we take a patient to the hospital, they are evaluated based on their level of need for urgent medical services. Patients are seen based on the nature of their illness or injury, not how they arrive at the hospital. And so we've talked about diversion. How does it affect the general public? Diversion is a temporary precautionary measure that hospitals take when the current patient load exceeds the emergency department's ability to treat additional patients promptly. It is important to note that a diversion is a request more than an order. It simply allows the hospitals to decompress. If another hospital cannot receive a patient or is too far away, the patient will go to the closest, most appropriate hospital, regardless of diversion status. Our teams on the front line are working nonstop to care for our communities. We are working through yet another wave of COVID-19, and we're continuing to provide life-saving services, not just for COVID patients. Between delayed care for the last 19 months, this current wave of COVID-19, there is no shortage of patients in need of emergency medical care. You can help your medical providers by seeking the appropriate level of care, getting vaccinated, wearing a mask, and social distancing from others. We are in no way here to judge you. We are here to help you. We ask that you please help us by getting vaccinated. It is now my pleasure to pass the mic to the leader of our COVID-19 battle, Dr. Cynthia Mora.
Thank you so much. We're here today together to show unity in our efforts to protect our community. We really need your help. Please get vaccinated if you haven't already done so. While no vaccine is 100% effective, we know this vaccine is safe and it works. Right now, people who are unvaccinated are 16 times more likely to get COVID than people who are vaccinated. People who are vaccinated are far, far, far less likely to end up in the hospital and to need those resources that we must preserve for life-threatening injuries and illness. It is so important for you to talk to people who have been vaccinated. If you have any questions, talk to your primary care provider, talk to someone who's gotten vaccinated who you trust, and make sure that all of your questions have been answered. We are here for you, we are here with you, and we will do whatever we can to help you through this. If you are interested in getting a vaccine, you can go to vaccines.gov to find the nearest vaccine for you. One thing that we haven't shared yet is that it is also critically important that we ensure that people who are exposed to COVID or who are experiencing COVID symptoms get tested. And what we've heard is that some of our urgent care centers, some of our emergency departments are being inundated by people for testing. We have plenty of places for people to get tested. Please go to our website to find a nearest testing site for you. You can go to one of our community testing events. We've been expanding those in the last week. We will continue to do whatever we need to do to expand capacity for testing. Please consider going to your pharmacy or talk to your primary care provider. But please do not go to the urgent care centers or emergency departments for testing. We need to preserve those sites for the people who need urgent care. If you have any questions about getting tested, please again go to the VDH website or you can call 1-877-VACCINE-Virginia. Finally, it's just really important for us, we're here together to show a united front. Let us work together to protect our first responders, our nurses, our physicians, our entire healthcare teams. When we protect those who care for us in our greatest time of need, we protect ourselves, we protect our loved ones. So please consider getting vaccinated if you are not yet vaccinated. Continue to wear your mask and social distance when you're inside, and make sure that you use the appropriate level of care to preserve our most important resources in our most important time of need for those who really need it. So thank you so much. We'll take any questions now. Really appreciate this.
I'm going to take the opportunity to thank our speakers today, and we're open for questions. Yes, sir. All right, so for that question, that's an excellent question. I'm going to turn to the colleagues. Would the hospital like to discuss that real quick about where we are and why we are where we are? And then maybe turn it over to EMS.
Well, thank you for thank you for that. I'm so used to wearing a mask. Thank you for that question. And quite honestly, what's brought us to this point is really the surge, the increase of patients. As I've said, we've admitted over 800 patients since July. Presently today at Carillion, we have across our whole system 140 patients who are admitted with COVID. Now that's a snapshot in time. That can change. It can go up and down. But we're also seeing that these are patients with a higher acuity care. They're sicker, they're younger, and their length of stay is longer. So when you see us all coming together here today, it really is, we're all feeling it. This is not just one hospital system that's feeling it. It really is another surge, but to us in healthcare, it's a different surge than it was before. We also have very tired workforce. We are really calling on our first line responders in EMS. So it's the surge, it's the resources, and quite frankly, we know that we have a great tool to combat this and to fight it, and that is vaccination. So that's really our message today. Please get vaccinated.
I would just add that it's taking a toll on everyone, first responders and staff, and the fact that we have a tool that can prevent it from occurring. It's sort of our responsibility to sort of sound the alarm that we can do something. And again, as you've noticed that in some parts of the country, they've gotten to the point where they're having to ration care. As I said earlier, we haven't gotten to that point here, but we don't want to get to that point. We want to make sure that we are communicating with our citizens and make sure they understand and see what we see and see the opportunities to resolve the problem.
Thank you for that question. Any other questions? All right, so we're going to go ahead and adjourn. We'll be available to also answer questions. We appreciate you coming out today and helping us spread this message of unity.